Hey guys, now in this next case, you're going to meet a guy who was in his 70s who had a history of hypertension, PE, severe anxiety, and something known as Lev's disease. Now let's take a look at the case and see how he makes out. Okay, guys, so here's the case. This was a 71-year-old male, history of anxiety, hypertension, PEs, and a pre-existing condition known as Lev's disease. Now, he was told by his PCP that he needed to exercise more. And so as a result, he started walking more. And once while pacing around his house, he said he became extremely lightheaded and dizzy, but didn't syncopize. His symptoms resolved immediately after sitting down. And when he came to the ED, he actually had no chest pain or shortness of breath, appeared pretty well. And didn't have any chest pain at that time either. His initial vital signs were significant for them being pretty normal, except his heart rate was slow, very slow, in the 40s. And here's his ECG. This was the first 12 lead that was obtained. And go ahead and pause the video here and see if you can put an interpretation to this. Okay, so let's break this down. Here's limb lead 2, and when you look at this, what is striking is that there are in fact P waves present, and there are P waves present and QRS present, except there's no communication, apparent communication between the P waves and the QRS complexes. The atrial rate is about 108 beats per minute, and the ventricular response about 48. The QRS complexes are narrow, so I'm going to call them junctional beats, and they don't seem to communicate. And what makes this a junctional escape rhythm is that the QRS is narrow, and the intrinsic rate is pretty slow, between 40 to 60 beats per minute. Now, just to kind of run through some terminology regarding junctional rhythms, junctional bradycardia, you see a bradycardic rate of about, less than 40 beats per minute. In a junctional escape rhythm, the rate is between 40 to 60 beats per minute. In an accelerated junctional rhythm, you should see a rate of between 60 to 100, and in a junctional tachycardia, you're going to see a rate of over 100 beats per minute. So there you have it. This was a complete heart block with a junctional escape, with the atrial rate being about 108 and a ventricular response being 48. So causes of complete heart block? Well, remember that MI is probably the most common cause, but he had no chest pain whatsoever or any associated cardiac findings. Don't forget about things like AV nodal blocking drugs. All right. And the most common one would be beta blockers, calcium channel blockers, clonidine and digoxin. Keep those in mind. And with regards to the other causes, well, keep in mind something called Lev's disease. Lev's disease is a degeneration of the conduction system that can also result in complete heart block. So what is Lev's disease? Well, it's exactly that. It's a fibrosis of the conduction system. It's most commonly seen in older patients and tends to be acquired in nature and accounts for over half of all the cases of AV nodal blocks. So when you see a patient like this, lightheaded, presyncopal, with a history of some kind of a conduction system abnormality, certainly think about the other things, but don't forget about something called Lev's disease. So that's it for today. Thanks so much for joining. Until next week, so long for now.